All right, well, let's get down to it. I know there's a lot of questions to get through. So I'll just go ahead and ask them, and then you can go ahead and answer as you want to. So the first question is, where were you raised?
Basically raised in Laguna Pueblo most of my life. I know that my mom spent short periods of time, probably after I was born, in Gallup, and then I know we had she had a place in Albuquerque, but I didn't really stay with her. I was back home with grandparents. Yep, grandparents. I was spoiled.
Were you?
That's how it seems. I mean, it's like the way I behave nowadays. It's like, how come I'm like this? Because they spoiled you, Joe. Oh.
No, there's a full circle moment now. Just kidding. Okay, could you begin by telling us about your own relationship to the AIA and disability community?
Basically, it became one-to-one when I broke my back in a car accident in 1988. I became a person with a disability, physical disability. Anyhow, yes. So that's really when it really started. Yeah, I mean, I had other interaction with other persons, not so much in our family, but community members, schoolmates that had disability that unfortunately we were cruel to, we were mean to, because we teased them because of their differences. So that, again, that was my I guess you could say relationship with people with disability. I did not, as a child and as a teenager, I did not understand how cruel we were being to these people by teasing them. So I don't know if that counts again, but it helped me, I think, in my later life, after I did acquire the disability, to know already that it was going to be deeper. Again, I didn't, the first couple of years after I was injured, it was, I was learning about myself. I wasn't worried so much about other people, but as I progressed throughout my disability life, which has been 30 some years now, going on 32, I believe, this January, I just have been in positions where I'm made aware that people are looking to me to be spokesperson for other American Indians with disabilities from tribal communities. And it started all locally. I'd say up to 4 years ago, I was attending meetings with the state human services department and regarding Medicaid, and different communities, disability communities, will come up, such as the developmental disabilities community group, and the human services department administrators would turn to me, because sometimes I would be the only American Indian in the room with all these other people, and that they would say, "Can you speak on this subject?" And I couldn't, I honestly couldn't. I could kind of give a, very 50,000, very high level, information, but it would just be real basic stuff like, oh, I know of some people in my community that have, MS or cerebral palsy, stuff like that. I wouldn't know about their care or what kind of care they were receiving or things like that. But again, when you're the only native in the room, sometimes people think you might be the expert, and it's like, nope, I'm not. So there's that intersection: disability, And then lack of information coming about out of lack of information coming out of the tribal communities, or information that's not getting to the right people, I guess you could say, concerning our care, our health care.
Mm.
Um, that's what's broken. I guess I'm going kind of jumping ahead to some of the challenges, but yeah.
Well, that's actually a great segue into our next question, which is, does your tribal government have a law or resolution that prohibits discrimination against people with disabilities and requires real opportunities requires equal opportunities for people with disabilities?
There is nothing. Well, I shouldn't say that. I do have the Pueblo of Laguna tribal constitution, but I do not believe there's a reference to disability there.
Okay, so how does your tribe protect rights and opportunities for people with disabilities?
Not very well. There's again, if department heads from tribal groups are not going to state meetings and informing state administrators that this is how it is at Laguna, then they turn to me, Joe, excuse my language, Joe Blow, or whatever. Some again, that's a to me that's the disconnect, and then unfortunately that's always been the case. I hate to say this about my tribe, and maybe it pertains to other communities too. Maybe there's some good communities out there that are really being helpful, but I find that my tribe, because of the over burden of people using their services, they only deal in generalities. My spinal cord injury and my needs are real specific, and when they give me generalities, they are not any help to me. So, and that's the same case at Indian Health Service. The turnover rate there is ridiculous, the providers, and I'm
Mhm.
the one educating the provider about myself and spinal cord injury. So um, there isn't that protection. I'm looking here in the code. Um, it's more about the government offices. Okay, here I'm at the Bill of Rights of Members, and it talks about self-government. Talks about okay, in exercising its powers of self-government shall not take any action which is in violation of the laws of the United States, as the same shall exist from time to time, respecting the civil rights and civil liberties of persons subject to the jurisdiction of the Pueblo of Laguna. So to me, that's, again, just a real vague reference to civil rights and civil liberties, but it's not specific to disability. And that's all there is. So I'm not sure about, I know that the former first lieutenant vice president of the NCAI, who I've known for about good 5-6 years now, Aaron Payment from Sault Ste. Marie band of Chippewas, he heard me speak at some of the meetings and sessions that I've chaired there at NCAI, and went back to his own tribe and created a discrimination code that again laid out provisions to ensure that people in his community were not discriminated against because of their disability. So again, some tribes are doing it, but as of yet, I haven't had that influence at Pueblo of Laguna. I'm trying. I'm fortunate to be. I am fortunate to be right now a board member for the Pueblo of Laguna's election um, committee. And recently, back in June, when there was an opportunity to speak up, I raised the point of creating an ADA-like code for our voters at Pueblo of Laguna. So just about a month ago, September 13th, we had a in-service with the New Mexico Governor's Commission on Disability and also the Disability Rights New Mexico staff to presentation with the Pueblo of Laguna's election board. So I was able to again bring that information to my election board to try and to bring them up to speed as to what was possible and where we might, and to see where we could go from there to ensure that our voters are not left out. So that, again, I'm starting there. I'm part of the Laguna Rainbow Corporation board also. So again, I'm definitely not, and the Rainbow Board governs the Title VI programs, Meals on Wheels at Laguna, and also we have a 58-bed nursing home, if you're not familiar with the Laguna Rainbow Elderly Care Center. And so I am aware of the needs of my people with disabilities that are forced to go into nursing homes because of the lack of housing in many communities, tribal communities. And the reason I wanted to join that board was to ensure that there wasn't any shenanigans going on against people with disabilities. I'm there to ensure their rights because no one else is there to watch out really for them. There's a lot of fancy language, but you know, unless you're on top of it, they don't really know.
That's true. All right. Let's move on to the next question, which is how does your tribe address support services for persons with disabilities and their families, such as home support programs, respite coverage for parents, personal care attendants, and other caregivers?
Right now, we have separate entities providing healthcare for our Laguna tribal members. We have the Pueblo's Department of Wellness, and then we also have Laguna Rainbow Corporation, and then we have a new entity called the Laguna Healthcare Corporation. And they just built a small clinic they're really struggling to get off the ground. You know, Rainbow has always had a hard time finding administrators. We're looking for an Native American Indian administrator candidate, but we cannot find anyone here in New Mexico. The one we had, we ran off. So she, there's no options with her. We had a candidate, but she didn't finish the program. She was almost done, and then I think all the regulations and the responsibility got to her somehow, and she just backed out. She walked away. She was our administrator in training, and she walked away from a $100,000 a year job.
Jesus.
Yep. And that's our dilemma in Indian country. We do not have those professionals yet. And that's my job, again, working That's what I'm trying to do at NCAI and all these groups, NICOA, to raise that awareness that we need to really promote education of our youth and adults to go into these fields, because we don't have our own people in there. It's really difficult. And that's what our people want. They want their own people manning those positions.
Yeah,
And
there's no
again,
one, and there's no one there yet. Like you said, we don't have people
I
there.
haven't given up. You know, my nephews has 2 young children. Maybe one of them will go into healthcare and be a nursing home administrator. It's a difficult job. I mean, I don't know what it takes. We had a woman from Laguna Pueblo, and she grew up in it. She almost straight out of college, she went into like nursing care, CNA, certified nursing assistant. And then she got into the administrator roles, and she thrived in that role for many, many years, almost 30 years. But she hit the wall, I think, and she just became overwhelmed. And we wanted to hire her, but the job we were asking from her was beyond her capacity, or we weren't giving her proper direction. I don't know. It just didn't. It only lasted like 6 months.
Oh man.
So yep, it was difficult again. And then, like I said, we had a Laguna woman, but somebody got to her, something got to her, where she couldn't do it. It wasn't in her heart in the end. And we don't hate her. We don't blame her. We pray for her. Maybe she'll come back someday, but
Mhm.
because again, right now we have a vacant administrator position. So we're trying, but again, and then the Laguna Wellness Program, as I stated earlier in my testimony regarding having to speak up on behalf of my community members with various disabilities, and then the lack of participation at that level anyway at community meetings by the various tribal entities. There, 23 tribes in the state of New Mexico, and Joe Ray is the only one that shows up, and he's just, I'm an advocate. That's where the breakdown is. Our own people, either they're overworked, understaffed, combination of both, or they do not care. I hate to say that, because I know our people care. They're not getting their priorities right. There's people falling through the cracks. Our people with disability, our tribal people with disabilities, we're having to do it on our own. Uh, um, I harp on voc rehab so much, but I pay taxes. Taxes come out of my salaries. Anytime I get a stipend, taxes come out of that. And where does that go? United States government, federal government. And federal government has a responsibility to me to the state of New Mexico, and in turn voc rehab, and then the American Indian Vocational Rehabilitation Program, a federal program. They're clueless. I hate to say that. The counselor there would send me job openings that I wasn't even qualified for or had no interest in. She was just stuffing envelopes, in my opinion. And that's really sad, because there are only 80 plus programs for tribal VR for over 570 tribes. People are falling through the cracks. We're going to work, college, school, all that. All those services that VR should be delivering. Again, there's a breakdown. And I'm just a lowly advocate. They will, they value people with degrees. It's not serving us. And yes, more people with disabilities need to get their degrees in these fields, but we're not. We're still having to overcome all the other barriers, like basic housing. Can't even get up in the morning and take a proper bath. Or I'm a resident of the nursing home and I've just given up on life. Laguna housing, they only built one house a year. It's really sad. So again, those are some of the challenges to the people with disabilities: lack of housing, lack of empathy, too much empathy. I'm sorry, overabundance of no, well, yeah, you know what I'm trying to say. Excuse
Yeah,
me.
I got it.
Again, that's a place where, again, voc rehab, so many people could succeed, and that's the one almost successful program out there in the state and the country that serves non-Indians with disabilities. But then I have a brother up in Durango. He has to be the third party advocate for his Diné brothers and sisters that are trying to get VR services, but because of their lack of understanding English, and all that
Hmm.
big fancy words, he's the third party, and he's frustrated. He's pulling his hair out. It's like, but it's in the law. Why are you guys denying them? They're denying services that they shouldn't be denied. So sorry, I went off on that tangent. You might have to refocus me there.
Yeah, no, like I said, it's actually a great segue for the next question, which is what are the major barriers for people with disabilities on your reservation? And
Again,
from your, oh,
it's
go
just,
ahead, sorry.
I was just going to say, throw on top of that, for many tribes, rural settings.
Hmm.
It's profound in Alaska. We barely. Hopefully, with all the billions and billions of dollars that have come this available, the infrastructure will be starting to get in place so that people with disabilities can access internet and get their services there. But again, it's slow to my community. Um, I haven't. Again, I did convince my VR counselor, I believe, to pay for my internet access at Laguna, but we've had a breakdown in communication there too. My VR plan changes so much. At the time I was creating my plan with him, I was only part-time, or I wasn't employed. But then I started a part-time job, and now during the election season, I'm full-time. So again, there's a few different factors that come into play with vocational rehabilitation and following through with your plans. But I had to be proactive. I was coming to Albuquerque to meet with him before pandemic, and many people in tribal communities are not as fortunate as I am to have a vehicle, um, to have the money to transport myself whenever I need to the state DVR office. Then, like I said, I pretty much have given up on the local program. They really did not know how to serve me. Um, there's a provision in the vocational rehabilitation law that calls for funding of what's called post-employment services. And that's what I always go back to my tribal program for. They cannot deny me stuff from that section of the law. Everything's legit, yet they make me go through through a whole process to get that funding. And it's like, it's not even worth it. The headaches. I mean, and other people will give up. I know people just plain give up because they don't want to be denied. They don't want to wait. They don't want to have to jump through all those hoops. And granted, we do have to have hoops, but again, it's I think it's just again bringing in consumers or clients of the programs to be advisory council. There's been a breakdown there. We used to have, as consumers or clients of the services of the programs, we would have a opportunity to provide advice or guidance on an advisory council. But a few years back, American Indian Voc Rehab got rid of that. And I'm not sure where it's at with the state VR program. I know they had it at one time, a citizen advisory council. But again, that in the disability community, we have this saying, and maybe you've heard it from me before or others. Please do not create programs for us without our input. Or, in short, nothing for us without us. Nothing for us without us. So that's where I spoke up in a national call last month or the month before. And again, no disrespect to tribal VR programs, but I put that out there on the table for the feds. They've taken that consumer input away from us.
Mm-hmm.
Yeah, so again, I don't know. I think we make a difference. I think all of us bringing our ideas, and then again, please don't send me job opportunities that I have no interest in. That was, to me, that was like, they don't really care. They're just stuffing envelopes. And I hate to say that because that's a fellow tribal member. So why are you sending me this? I'm not going to apply for this job. I'm at the time 20-year consumer advocate, tribal advocate. I was already paving my road down that avenue, but they couldn't see that Joe could support him in this manner. Well, now I have a full-time job promoting. Well, it's disability right. It's not disability voting rights. But again, it's something I created that they didn't have a clue about. So.
Okay. Well, this is all great stuff, Joseph. I really appreciate you talking to me about these issues.
Well, I'm trying again. There's other barriers like barriers to healthcare. Again, I'm fortunate that I can drive myself up to the local ACL hospital. I don't have to wait for somebody to take me. I know that in the past there's been issues with local transport of people in wheelchairs, like with our own program, that Title VI program.
Mm-hmm.
Certain individuals have been denied service because, we only have one van with one wheelchair ramp. Our tribe is the second ranked gaming enterprise in the state. That's ridiculous. We only have one accessible van. Again, it's like, where are our priorities?
Mm-hmm.
The Pueblo of Laguna blew 30 million in a boondoggle 2 years ago in the state of Mississippi, Louisiana, Lake Charles, Louisiana. We didn't do our homework. We ended up signing a document that cost us 30 million from our gaming. Yep. Oh, just appropriate another 30 million. We'll cover that. Well, how about our elders? Oh, excuse me. I don't mean to raise my voice, but again, the tribal, the Pueblo, the nursing home is 30 plus years old, and you can blow 30 million just like that because the councilmen don't want to disclose their IRS to the state of Louisiana. Huh.
So
Yep.
you would add misuse of funds to the list.
I'll go there. Yeah, I mean, how do you say it? I mean, again, lack of priority for tribal elders. I mean, we have, yeah, Lagunas are so prideful. We boast all the time. Oh, we have business people. We have, masters, master, what are they? Yeah, masters, MBS, um,
I think MBA.
MBAs. We have MBAs, but yet, again, and we can't come up with these strategies to really benefit our people without losing 30 million. Come on, we don't have, we have so many prideful people that they like to talk, and yet, here's elder and grandma and grandpa down at the bottom. It's really sad. So again, I don't know how any other way to say it other than lack. Lack.
Yeah, I believe you said lack of priorities for elders.
Yeah, I'll say it. Oh man, again, it's like, how do you say that? And be nice to these guys who, in the big picture, they're thinking, oh yeah, we're trying, Joe. We're working at Laguna Gaming to create profit that can go back into the general fund that our tribal elders then can be covered for services. I'm hoping that that's their big picture plan. Well, we're not seeing it. Again, they're telling Laguna Rainbow Corporation, go find your own money to build your new home, to build your new nursing home. And we did. We do have a process. But because they're so slow at tribal administration, the meeting that we should have had like 3 months ago, we haven't even planned set yet. So again, come on, guys. And I'm fortunate I can go to NCAI and speak up at certain times like this to them because I am the disability subcommittee chair. And I forget that at times. I don't throw that around as much as I think I should. And if they want to get rid of me, they can. But I need to push it, I think.
Okay. What? This was another question that you kind of touched on where the question is, what are the barriers to healthcare experienced by people with disabilities in your tribal community?
I'm trying to find that doc too so I can go along with you. Would you repeat that, please?
Yeah. What are the barriers to healthcare experienced by people with disabilities in your tribal community?
Again, it's just we don't have enough. We only recently have I heard that the community health representatives could transporting again, or I think they were transporting only certain individuals, but they're able to be providing more care, and they're really the first line of defense, I guess you could say, in our communities when it comes to healthcare. That it used to be traditionally that the CHRs were who we called, and they're under the Pueblo of Laguna. Recently, again in the last couple of years, we've had Pueblo Laguna split with the ACL hospital system, which is strange because I still go ACL for my services. But in the Bureau system, Indian health system, there's healthcare shares, and Luna took their healthcare shares, which have dollar value, took them into a 638 contract. And again, we have this new clinic that is sputtering. They're trying to be open, but we're at Laguna Pueblo. We are used to the 24/7 service that we received through IHS at the ADL service unit. And many of us are in fear of our tribe taking over that system totally. Because, again, everything gets pushed through the system so fast that, again, maybe it's been explained to the community what's going on, but on one hand, there's a from ACL, IHS system, and then we have our own NIC, but it didn't have an ER. So we're having to still go to ACL for after hours care. Or again, some of us, like me, I don't have any faith in the Laguna Healthcare Corporation. To me, it's going. I am going to have to fill all their paperwork, and then I'm going to have to educate their provider about my spinal cord injury, when that doctor is the general practitioner. They must well just, send me. Again, that's I'm going to be referred out to a specialist. I won't be receiving care there at that so-called Laguna Healthcare Clinic. So it didn't serve me at time to go over there. I went up to ACL last Wednesday for some treatment, and they have all my records. They still serve me as an American Indian. I'm so thankful because I have no faith in my Laguna Healthcare Corporation right now. That's a big barrier. I know other tribes, as I said, going around the country with NCAI and meeting people through like NICOA conference in Reno, speak with my peers there. I know there's a breakdown in many tribal communities. None are perfect. So I think we can say the lack of transportation, just lack of opportunities. Again, not enough staff to take people to their appointments. It's getting a little better now that tribal communities are getting vaccinated, but again, that's still a barrier. Lack of transportation, lack of access, lack of internet. Hopefully it'll get her. We'll re-elect President Biden for a term, or VP Harris, and we'll keep these programs going, because I fear that if a Republican comes back into office, it's going to be back to the old furnace days. It's not going to be good.
Mm-hmm.
Yeah, we're having a tribal election, or a federal election coming up, or state election, but the only position that's up for re-election in my area is a school board position, and that's another place where there's a barrier to healthcare. When the elected leaders don't move on the needs of their constituents. People voted for them. You know, there's that's a barrier. So again, I work in that field too, to try and bring awareness to legislators and community.
Yeah, that is a lot of information to process. But again, thank you, Joseph, for
Lack of
your
data.
thoughts. Lack of data.
The data isn't getting right into the right hands, or you know, there are all questions for me are, oh, Joseph, what are number one health or issues in your community? It's like, don't you guys know that? You guys are in information overload up there in Santa Fe, in D. How come you're asking me? You should know from our reports. We report to you guys. So again, it's basic, real big healthcare. I mean, heart, cancer, diabetes. It hasn't changed. And then underlying all that is still substance abuse. I was I was teasing some of my brothers the other evening. They were hitchhiking the line to the bar. It was 5 o'clock in the evening. I was getting home. I didn't have time to run them up for a run. And it's like, and they kind of looked at me like, "Come on, Joe," and I'm like, "No, I'm not gonna take you." But why are my bros there? That's what they do, is they spend their time catching a ride to the bar, then catching a ride back home with their little bottles and all that every day, every other day, whatever it is. We don't under domestic violence. Oh my God. I experienced it myself. My nephew-in-law kicked me out a couple of weeks ago. And it's like, he could get in his vehicle, come now and down here and beat me up the way it behaves at times. He has outbursts. So it's like, oh man. Then he drinks too on that. He's married to niece, and they're God-fearing people supposedly, but yet he cussed me out, or questioned his uncle in-law. It's like, come on. I don't talk. I mean, thankfully we don't see it firsthand. My niece is, again, stories she's related. She's had her bumps and bruises for accidental, but again, and I believe her. I want to believe her. But then when you live in a household when your partner has a history of acting out, I kind of question some things. So, yeah. Substance abuse, which leads to that domestic DV, domestic violence. So.
Yes, that's unfortunate. Were you able to find the questions or the document for this? I know you were looking earlier while we were talking.
No.
Do you want me to resend it, or are you okay?
I'm down to percent on my battery.
I'm sorry, I didn't catch that last part.
2% on my battery.
Oh dear. Okay.
So
well,
I plugged it in. I'm in the ride, so hopefully it'll go up.
Okay. Well, if not, we could continue this later in the week if you're available. Or would you, because
Where were we at?
we have 5 questions
Oh
to get
yes,
through.
we're still on the first page, huh?
Yeah.
Yeah, yeah, the bottom of the first page, I see it. The question, are children with disabilities treated differently in school systems? Um, I would really say things have gotten better for the youth with disabilities because their teachers are aware and they're trained to create those um, education plans at level. So I'm hoping that I'm confident to differently with our school system. But for us, the trend of how either bullying, that I can't speak of. I can't recall. My niece she goes to NICOA, she's in 3rd grade. So she hasn't come this year feeling bullied, and neither has the little boy. He's in 6th grade, I think, or K. And they're doing all right. My granddaughter in Phoenix, she hasn't come home, but not to have disabilities. But again, that's the only concern is how children with disabilities are treated their peers if they're being bullied. That would be a concern. I don't hear about it. Um, Again, because of my because of my notoriety, sometimes people come to me and reach out to me and ask me questions about different areas. We're not the expert, but lately no one's reached out to me in that manner. Secretary Trujillo from the state wanting to find advocates for the DDPC for the state. I sent her someone, so hopefully they're working together.
Okay. Well, let's go ahead and go on to the next question then. What services supported employment, transportation assistance?
Right. Again, right. Again, all those within that parentheses could be covered by and probably are being covered to a great extent, first timers through the full VR programs. I'm hoping that people will be savvy enough that when they find out that I have a tribal VR program, that they will then say, okay, well, since there's nothing tribally, maybe there's something county-wide, and maybe there's something in their county, not here in New Mexico, but maybe there's something in Sister Pueblo. Well, there is at Voc Rehab, and maybe somebody gets a referral there, or maybe again that person with a disability goes to the next level and says, okay, there's a DVR office there maybe for service. So that's been there forever, as long as I've been disabled, and it still continue to be. And again, I think that advocacy, more continued strong advocacy, not only by the tribal VR program, but state programs, and then on the federal level, the programs that administer funds to states that have large amounts of tribes, they need to be doing awareness. They need to bring themselves up to speed to go out to their awardees and say, okay, we have these resources for you to draw on to serve tribal communities. it needs to all go back to the funder. They need to do their, what's it called? Their due diligence with their cultural competencies, especially if they're trying to serve our communities. Because maybe they're beginning to do it, but they're not. Department of Workforce Solutions in New Mexico, I reached out to them years ago about that program through that is called oh shoot, I don't know, I can't recall it now, but it was just a new program that was implemented regarding more considerations for employment of people with disabilities. I'm real come to me in when I a couple minutes or so, but yes, there are various programs that come through the federal government that award state programs, and then they in turn are not doing, they're serving other people, but where people with disabilities are also included in the language of their people that they're supposed to serve. Yeah, they're serving veterans. Yeah, they're serving other adults with challenges to employment, but they're not serving specific clients with disabilities. Oh, I can't even snap to that program. It just came in through the feds a couple years ago. Do you recall what that might be?
But I could look it up really quick.
No, I can't think. Sorry, Ray.
I am not too sure. I'm looking.
Shall we go on? Move on?
Yeah. Okay, so the next question would be, what changes would you like to see made?
Just more inclusion of people with disabilities in the decision-making process. As I was testifying earlier, it seems that we've got tuned out in the DV system.
In the what system?
In the voc rehab system.
Oh.
Just more inclusion of people with disabilities on a broader scale in all the programs that affect our lives. Housing, healthcare.
Okay. Is there anything else you'd like to add to that?
Mm-hmm.
All right, let's.
I guess just more training for tribal wellness programs so that they're covering all their bases.
Okay. All right, and then let's go to the next question. What suggestions or recommendations do you have that would improve communication and collaboration among federal, state, tribal governments on issues that would improve support and services to people with disabilities in Indian country.
Um, I think it's a lot of times we need help on the grand scale with our infrastructure, that the only way things are going to get better is our basic infrastructure needs are being met. And as I stated today, I had to come to Albuquerque to communicate with you, to ensure that I could communicate with you. And I'm not sure how many people are suffering through the lack of service right now. I can't be the only one. But maybe, maybe I'm the dumb one. We really need that support on the federal and state legislative levels to create more funds to come to our communities, and then in turn the tribal governments to acquire the knowledge about how to acquire that money. I get my wrist slapped when I say to my tribal leaders, "Oh, Representative so and so wants to give me $100,000. Can I take it?" And they'll say to me, "No." "Oh, are you in the tribal infrastructure plan?" "No, because I didn't. I'm not. I mean, yes, we are." Okay, we get denied there, but we're not going to go for any more money at Santa Fe. "But I found the money." "No, we're not. You're not in our plan, Joe."
Jeez.
So I have to tell my friend legislator in Santa Fe, "No, we can't accept that money because it's not in the tribal system." Maybe next year, but maybe next year they won't have that money. So again, it's tribal governments aren't doing educating themselves on how if you just show your face in Santa Fe sometimes. "Oh, Joe, we've never heard from a voice like yours. Here's $500,000 fund your to build to an office for you." Tribe won't take it because it's not in their plan. I can't tip because it's tribal land. So many barriers like that, Desiree. Administrative barriers. On all those levels. Hate to single out the tribe, but that one affects me personally a lot of times.
And those are your suggestions or recommendations that would improve communication and collaboration? Is the basic infrastructure
Well, as I
needs?
stated, the collaboration isn't going to happen when there isn't any infrastructure. You can give us money, but we can't even access it. So you're probably a better wordsmith than I am, but that's what I'm trying to say, is that until we have that communication infrastructure, there is any collaboration that's going to happen. That was my wordsmithing there.
Okay.
Again, my example, I had to drive to Albuquerque to receive services. I have to drive to Laguna Pueblo to get a cell signal. If you don't have a car, well, you're SOL. Excuse my language.
Okay, I think that wraps up that question. And now we're on to our last one, which is, what is one positive action, event,
Yay.
activity that you see happening in the AI/AN disability community currently happening?
Oh, I see a lot of youth with disabilities getting active in our field. I was on that Native America calling a few weeks back with 3 persons actually that with disabilities that I'm trying to access to bring into the advocacy field that I'm working in at NCAI. One is Miss Wheelchair USA, who happens to be from a tribal community. So, you know, I'm really hopeful for the future. Well, not only youth, but also other adults with disabilities that are becoming engaged. So many of my younger peers are getting degrees in fields that are leading to becoming disability services advocates, as I call us. That again, they're going to continue this job that I'm doing into the future. And they're already doing it in their own ways. We just need to come together. So that's my hope, is that we're building something. I don't know if you saw on Indian Country Today a few weeks ago, Desiree, there is a woman from state of Iowa from, I can't recall what tribe from Iowa, but she's the Native American Democratic Caucus chair. She's a person who is deaf, and Sharon Lone Wolf. Oh, I can't recall her name, but I'm gonna find her, and it's like I want to meet her because she is so empowered. She's making change, not only for the disability community in Iowa, Native disability community in Iowa, but for all the people, Native people in Iowa. An advocate. She's a mom, I believe. So, you know, she's so powerful. I saw on Indian Country Today, and it's like I have to find her. So that's my hope. That's what I'm banking on.
I see. Okay. Do you have anything else you'd like to add before we wrap up?
No, not so much. Again, I just think again, just the inclusivity needs to be built into many programs. Being inclusive of other people with differing disabilities. You know, I'm fortunate that I have a voice. My disability doesn't limit me, and again, just that's what I want to see, is that all inclusiveness. And yes, it takes money, and it's hard at times to achieve it, but I mean, we could try. The woman in Iowa, her name is Sarah Young Bear Brown. Yep.
Sarah Young.
I saw her on Indian Country Today, and it's like, oh man, I have to meet her. Excuse my language. She kicks butt.
All right. Okay. Yeah, I think that wraps up this interview. Thank you, Joseph, so much for helping us in this project. You've been amazing.
If you have any spaces you need to fill in my interview, please let me know and I can respond to that. Maybe I've left out some things or led you down a trail and I didn't complete my thoughts, stuff like that. And maybe they're good enough to include. You want me to finish those thoughts? I don't know, but again, um, just happy. Thank you for being. Also, thank you to NICOA, for including me. As I said in my testimony today, it's going to take all these various platforms and avenues of communication for us to really to start making progress. I mean, there's so many bases to cover, and we're all trying to do our part. So thank you to NICOA.